The term metabolic syndrome refers to a group of risk factors that place you at increased risk for developing two conditions, diabetes and heart disease. There are many different definitions of the metabolic syndrome. The one that most use include five risk factors. First, hypertension, which is high blood pressure. Second is high levels of fats or triglycerides. Third is a low level of your HDL or your good cholesterol. Fourth is obesity. And fifth is an elevation in your blood sugar level. If you have three of those abnormalities, high blood pressure, high triglycerides, low HDL, being overweight, or having an abnormal blood sugar, then you're at very high risk to develop either diabetes or heart disease or both in the future. The metabolic syndrome is very common in the United States. It increases with age. So if you're in my age group, I'm 56, about 25% of the population actually has the metabolic syndrome. By age 80, about 50% of individuals have the metabolic syndrome. It increases dramatically with obesity. In fact, about 80% of obese individuals qualify as having the metabolic syndrome. Most experts believe that central obesity is actually the root cause of the metabolic syndrome. So I want to spend a few minutes discussing central obesity with you. We are supposed to store fat in our skin. Unfortunately, once you fill up the fat cells in your skin, the fat has to go somewhere if you keep eating. And where it might go is to the liver. In that case, you would develop a condition called fatty liver. Or it might go to your muscle, in which case you would develop insulin resistance in that organ. Or it might go to the pancreas. When fat goes to the pancreas, it actually destroys the cells in your pancreas that make insulin. So you're at high risk for developing diabetes. So central obesity refers to ectopic fat, fat where it doesn't belong. Instead of being in the fat cells in the skin, it's in the organs in the middle of your body where it's damaging those organs and leading to diseases such as fatty liver and diabetes.